there, my name is Lynette. I'm a nurse. I'm going to be doing an assessment on you today. What is your name?
Juliana Avery.
And your date of birth?
10/07/05.
Wonderful. Come on in and have a seat for me. As she's walking in, I'm assessing her gait, seeing if anything overtly stands out, if there's a smell, if she's dressed appropriately for the weather, posture, etc. I'm going to go wash my hands, and I'll come on in. All right, so today what we're going to be doing is just giving you a kind of a quick, brief overview of all the body parts on you today. So I'm going to ask you a couple of questions before we get started.
Okay.
All right. So are you having any sort of problems, any sort of sicknesses or pain or any concerns or anything you want to talk to the doctor about? Okay, very good. About how tall are you?
5'3"
Whew.
and a half.
And a half. I will give you that half. And about how much do you weigh?
92 pounds.
92 pounds. All right. And do you have any sort of allergies to any food or medicines or anything environmental?
Yes, ma'am. Wasp and bees.
Okay. What happens to you when you get bit by the wasps or bees?
I swell up.
Oh, okay. And if I'm assuming that's happened before.
Yes,
So
ma'am.
what do you do to treat your insect bite or your?
We take Advil and Benadryl.
Okay. Alrighty. Very good. Alrighty. So, what grade are you in?
8th grade.
8th grade. All right. Do you know the name of the school?
Berkeley Accelerated Middle School.
Okay. And you're sleepy. I tried to catch you early enough. I know.
I tried.
I know you did. Okay, so I'm just going to do some vital signs on you really quickly. Alrighty. While that's cooking, I'm going to take a quick temperature here. Wonderful. Lovely. Perfect. Take a blood pressure. If you'll uncross your legs for me, thank you so much. Alrighty. You're going to see the little blue light. Once you see that, you'll just, there you go, perfect. Wonderful. And so I've noted while she's doing all of that, her orientation as well, and just a kind of a general overall assessment of her features, making sure everything is symmetrical just by inspection on her face and upper body at this point. Lovely. Okay, that's wonderful. Where was that on there? Alrighty. So I am going to I'm going to mess up your lovely hair. I am so sorry.
It's so pretty.
It's so pretty right now. If you could sit up nice and straight for me and just kind of turn that way. Wonderful. Okay, so I'm going to be taking a peek at your hair and your scalp here. You have any issues with your scalp or with growing hair or your dandruff or anything like that? No. Okay. Any tenderness whenever I touch? Okay. So all of that is good, and I've kind of tugged on her hair and making sure all of that is okay. So her scalp is everything is intact. And her hair distribution is even, no bumps or lesions or tenderness. Everything is symmetrical on her head. Okay, so now I'm going to, all right, I'm just going to move the chair right here just so I can see your face. All right, so do me a favor and raise your eyebrows for me and down. There you go. Now puff out your cheeks. Now smile. Can you frown? Can you maybe like gnash your teeth? Nostrils flare, also very lovely. Okay, all of that is good. Okay, so this is going to sound kind of silly, but this is a little bit sharp and this is a little bit soft. So I want you to close your eyes for me and tell me if this side is the sharp side or if this side is the dull side.
Sharp side.
Sharp side. What about this?
Soft side.
Soft side. Okay. Alrighty. So I'm going to look inside your. Actually, let's open your mouth for me. All right. Say ah. All right. So I see some metal inside there. What's going on in there?
It's my expander.
Okay. So it's like orthodonture kind of stuff. Okay.
Yes,
very
ma'am.
good. So stick your tongue out again. All right. Lift your tongue up. All right. And side to side. All right. Let's see your teeth again. All right. I'm going to pull your lip down here. And I'm going to look inside. All right. All that looks good. Okay. I'm going to check out your nose too. Everything is nice and symmetrical. I'm going to look up your nose. Oh, that's good. All right, breathe in and out. All right, do it again. Okay, and then I've got something here. I want to close your eyes and I'm going to have you smell and you tell me what you smell.
Watermelon.
Watermelon. Now keep your eyes closed. Let's do it again.
Watermelon.
Watermelon. Very good. Okay. And now let's take a look at your, all right, scratch your tongue. Okay, got your lips and all your teeth and all that. I'm going to take a look at your eyes, okay? All right, lovely. Very good. Okay, I'm sorry about that. Okay, very good. All right, now follow my pin for me, okay? All right, very good. All right, oh, that's good. It's kind of hard, I don't have a desk here, but I would be documenting all of this as I am going down. Now, do you wear glasses?
Yes, ma'am.
What for?
For reading.
For reading only, okay. So at this point, if I had a Snellen chart, I would have her read the chart and document the findings from that. Let's lean forward for me again. I'm going to, it's a little dark in here. I'd have better lighting first off, but I'd be looking in, all right, inside the conjunctiva and all of that. All right, very good. You don't wear contacts or anything? Okay. All right. And now I'm gonna check your hearing. If I had a tuning fork, I would do the Renee and the Weber, which I do not. Oh, thank you. Okay. All right, and you can just kind of look forward for me. And I'm just going to check your ears out. If I had the appropriate lighting, I would use it at this point, but I'm looking inside. Any sort of pain or tenderness with this ear, I'm going to tug on it, push around. No problems there. Whatever I do to this side, I'm going to be repeating on the other side. Okay, I'm stand behind you. I'm going to whisper and you tell me what I'm saying.
Merry Christmas. Thank you, Dr. Lucy.
Okay, wonderful. All right. So everything is good with the hearing. You don't have any hearing issues per se other than selective hearing when your mother asks you to pick your socks up.
Yes, ma'am.
Correct. All right, very good. That is all good. Checked your nose and your smellers and all of that. Okay. Okay, so now let's, wish I had a desk here. All right. Any sort of pain when you open and close your jaw? Nothing like that? All right. All right, so I'm going to go ahead and let's move this here so my hind end isn't in my computer's way there, though. All right. So can I move this chair just a little bit more forward? There we go. Go ahead and have a seat, baby. That's good. All right. So I'm just going to kind of palpate here and feel her neck and her throat, checking some pulses, also feeling for tenderness and masses. No issues there. Can you swallow for me? All right, lymph nodes and all of that. No problems there. Raise your shoulders for me. All right, very good. Okay. Document all of those. And you have any problems with your neck? If you do a little moving around of your neck, no issues?
Mm-hmm.
Okay. So if we had her on a bed at this point, she would be at a 45-degree angle, and I could be assessing her JVD at this point if I had her laying down. And okay, so get my. Do me a favor and just kind of scooch to the front just a little bit. I'm just going to listen to your lungs, okay? So whenever I put the stethoscope to you, just kind of take in a big breath and blow it out. Excellent. Okay, so at this point, I would be listening in a ladder formation and then down the sides. And again, on the front, I'll be auscultating breath sounds and documenting my findings with that. I would have already assessed her respirations and have documented her respirations. No history of breathing problems, asthma. What about any family history? Any of these things that we're covering, any family history? Okay, and at any point, if there's any pain or if there's any questions or anything, just stop me and we will certainly address that.
Okay.
Okay, so, all right, I'm going to be kind of looking at her spine at this point. If I had a gown on, I'd be able to see her exposed back. That's okay. I'm looking at her spine, but I'm also looking at her back. I'm kind of palpating just her thorax to see if there's any deformities or masses, and the same thing on the front, if there's any pain, tenderness, or deformities on the thorax up front. And maybe I can put this right here. That might be easier. Document this as I'm going here. Oh, not again. Sorry. Right? Okay. So no coughing. I know a lot of people have been getting sick and all of that. You've gotten your flu shot already and all of that. Did you get your flu shot? Okay, very good. Okay, so now I'm going to listen to your heart. Okay, and I'm going to be listening ape to man. Get your little necklace out of the way here. Thank you, love. Okay. You just breathe normal. Okay. Okay. And could also be taking a apical pulse at this point. Okay. I will be documenting all of this. Alrighty. Now there's going to be a couple of times we're going to have you kind of stand up and sit down and that sort of thing. So at this point, if you don't mind, go ahead and having us just a little quick lay down on the bed there. Go. Oh, thank you. All right. Put this right here. All right. Can you scooch down just a little bit? All right. And again, if I had a gown on her, I would be taking a look at everything laying down here, and I'd be obviously not sitting on the bed, but go ahead and move your arms for me. I'm just going to be inspecting your belly here, so I'm looking at everything. I'm going to be auscultating for bowel sounds in all the quadrants. Okay, I'm going to do that. I'm also going to be listening for any brewing. And now I'm going to, I know you're ticklish, so I know.
Okay.
All right, so I'm going to be feeling all of this, okay? And any pain or tenderness, any problems with the bladder or anything like that. Okay, at this point, since I've got her laying down, I'm going to go ahead and percuss everything as well. All right, so. Okay. Do it down here as well. When I have her sitting back up again, I will also percuss the front and the back. I forgot to do that whenever I had you sitting up. Since I already have you laying down, I'm going to go ahead and check your range of motion with your lower extremities, okay? So I'm going to, you can just go put your arms on your abdomen. You have to be like a dead person this side. Okay, so at this point I'm just going to move around. Any problems with your hips, okay? All right, same thing, okay? You're feeling her feet, okay? Push against my hand. All right. Any problems with that? No problems walking either. Okay. So I would also assess and palpate and auscultate any of her arteries that I could, and I would document all of that. I would also check for capillary refills in her toes. I probably won't be able to assess the cap refills in her hands because of her fingernails, so I'll make sure to get it on her toes. And I have felt for all of her arteries at that point. Again, I would do the same thing on the opposite side. At this point, I'm also assessing her skin as well, looking for any bruising, any tears, any sort of rashes or anything like that, and I don't see any. Can I help you sit back up? All right. You can actually just sit on the side of the, yeah, that should be fine. That should be fine. Alrighty, so now I'm going to do the same thing with your arms. So, any issues with any of that? Alright, grab my hand and squeeze. Alright, get palpating and assessing all of that. I can also, I will palpate and auscultate her arteries. Looking at her skin. Oh, that's wonderful. Okay, we can do the, close your eyes, that's okay. Close your eyes and tell me if it's sharp or if it is dull.
Sharp.
Okay. Or soft, okay. And I'm going to do the same thing in the tops of your feet here.
Soft.
Sharp. All right, wonderful. Documenting that. All right, so already assessed your gait. Okay, so have you already started your period?
Yes, ma'am.
And when was your last period?
11th.
The 11th, okay. Do you have regular periods?
Yes, ma'am.
Okay, so every 28 to 30 days, something like that. How long do they usually last for?
5 days.
5 days, hey, that's nice. Okay, no bad cramping or anything, just kind of a normal flow? Okay.
Yes, ma'am.
All right, so I would assess her female anatomy, but since this is what we're doing, we're not gonna be doing that. I would also, once I had her lying down, assessing her thorax, I would also have been assessing her breasts and checking for masses and tenderness and discharge of the nipples and that sort of thing. No family history of female problems, nothing like that. Okay. All right, so now that we have essentially completed that, I would talk to you a little bit about wearing sunscreen out in the Florida.
Every day.
Every day, the Florida sunshine. Maybe touch a little bit on proper diet, balanced diet, drinking enough water, getting enough sleep.
That I do.
That you do, yes, that you got. You got that one down just right.
If Capri Suns were water.
If
then
Capri Suns
that
were
would be a
water,
different
right,
story.
since they are not. Okay, I think I've done I've done everything. Did all your reflexes everywhere? I've percussed everything while you were sitting back up. I think we did it. All right. Hand hygiene, and I would escort you out. You have a lovely day.
You too. Bye, Dr. Lucy.